Welcome to Nursing School.
Welcome to Nursing School.
Topic of today is ethics in nursing practice. Ethics, a branch of philosophy concerned with determining right and wrong in relation to people's decisions and actions. A study of all philosophical ideals of what is right and wrong behavior. Differences between right and wrong. Nursing ethics are ethical issues that occur in nursing practice. A deals with the conduct of nurses, a protection of client right, a what nurses ought to do rightly. Deontology is an ethical theory that uses rules to distinguish right from wrong. Principles of ethics. There is 4 ethical principles of ethics in nursing. Autonomy refers to person's independence, self-governing, self-determination, freedom to make independent choices. Patient has the right to make decisions for themselves. A consent for treatment issues, informed consent, right to know procedure complications, other options that are possible. Justice refers fairness, fair distribution of resources/benefits. Beneficence refers to taking positive actions to help others, encourages the urge to do good for others. Non-maleficence refers to harm or hurt. Non-maleficence refers to the avoidance of harm or hurt. It includes the duty prevent and / or remove harm. Ethical practice involves not only the will to do good, but also the equal commitment to do no harm. For ethical rules, veracity involves issues of reliability. It means accuracy or conformity to truth. It guides nurses to practice in truthfulness manner, the obligation to tell the truth and not to lie or deceive others. But limitations sometimes can arise equals when nurses in situations where telling clients the truth would seriously harm, principle of non-maleficence, their ability to recover or would produce greater illness. Privacy, confidentiality. Keep privileged information private. Exceptions to protecting one person's privacy harms another or threatens social good. Direct hazard to another person. Fidelity refers to the agreement to keep promises. A commitment to fidelity explains the reluctance to abandon clients, even when disagreement arises about decisions that client may make. Accountability, ability to answer one's own actions. Nurse is accountable to self most of all. Nurse balance the accountability to the client, profession, the employer, and the society. Code of ethics are a written list of a profession's values and standards of conduct. Code of ethics are a written list of a profession's values and standards of conduct. A general statements, a periodically revised, serves as framework for decision-making, offer guidance, not legally enforceable as laws but consistent violations indicate an unwillingness by the person to act in a professional. Ethics. International Council of Nurses, ICN, Code of Ethics. Of 4 fundamental responsibilities of nurses: to promote health, to prevent illness, to restore health, to alleviate suffering. The need for nursing is universal. Elements of code: nurses and people, a nurses and practice, nurses and profession, a nurses and co-workers. An ethical dilemma is when there is action or situation that involves actual or potential harm to someone or something. Types of ethical dilemmas. A most moral dilemmas in nursing/midwifery can be identified according to ethical principles. Dilemmas of beneficence. A dilemmas that involve deciding what is good as opposed to what is harmful. Dilemmas of autonomy. A dilemmas that involve deciding what course of action maximize the patient's right of self-determination. Dilemmas of justice. A dilemmas that involve dividing limited healthcare resources fairly. Dilemmas of fidelity. Dilemmas that are involve honoring promises. A dilemmas of non-maleficence. Dilemmas that involve the avoidance of harm. Dilemmas of confidentiality. Those that involve respecting privileged information. Dilemmas of veracity. Dilemmas that involve telling or concealing the truth. How to process an ethical dilemma. 1. Recognition of ethical dilemma. Determine whether or not a dilemma exists. 2. Gather all relevant factual information. 3. Clarify the personal context of the ethical dilemma. Reflect on your values on the issues. Identify and clarify the ethical concept. 4. Verbalize problem. 5. Consider all possible courses of action, including referral to ethics committee. 6. Negotiate outcome. 7. Evaluate action, not the outcome. Scenario 1: a 48-year-old male is hospitalized in intensive care unit for end stage of lung cancer. He is complaining severe pain, dyspnea, productive cough mixed with blood and weight loss. In addition, he has HIV infection and is in stage 4 of AIDS. He is widow and his 2 children died 1 year ago from accident. He asks to you to help him for suicide. How are you going to receive that request? What is your first feelings? What will be your clinical approach about this case? Scenario 2: a patient aged of 70 years recently underwent abdominal surgery when it was discovered that he had carcinoma of the stomach. It was not possible to remove the tumor, and there was evidence of a secondary cancerous growth in the liver. The patient's family has been informed of his prognosis. They have requested that he should not be told the truth until it is absolutely necessary. What are ethical principles or concepts involved? After analysis, give a summary of ethical questions raised or addressed. What will be your clinical approach about this case? Scenario 3: a patient aged of 50 years had an operation to relieve chronic back pain. Before his surgery and following a discussion with a doctor, he signed a consent form. The surgery was completed successfully, but the next day, the patient informed a nurse, "I didn't have a clue what I was signing when that doctor came to see me the other day. I just did what he asked me to do." What are ethical principles or concepts involved? After your analysis, what are ethical questions addressed? What will be your clinical approach about this case? Put answer of this question in comment after understanding well content of today.
Thanks for following nursing school. Remember to subscribe, comment, and share this video to your colleagues.